Hi everyone, today we're going to be covering the cerebral cortex, which is the main part of the brain that we think about when we're actually talking about the human brain. This section has a lot to do with our sensory processing as well as our higher cognitive abilities, so the way that we think and feel and have our personalities as humans. And so when we talk about the cerebral cortex, we're going to be talking about the four major lobes. Starting at the left, we have the frontal lobe. It's in the front of your head, kind of behind your forehead and a little bit behind your eyes. Below that, we have in the yellow here our temporal lobe. That's right behind our ears. In the back, we have our occipital lobe. That's like right back behind, just like straight back from your eyes. And then on the top of our head, from the top of the crown to like the back third, is our parietal lobe. Now, each of these lobes has subcomponents that we're going to be talking about, and they each have different functions. So starting in the back, because it's kind of like our oldest section, this is the part that develops first. This is our occipital lobe. So the occipital lobe has to do with visual processing. You can see here in the very, very far back, right at the bottom, we have our primary visual cortex. So information that comes from our eyes goes straight through to the thalamus in the center of our brain, that subcortical structure we talked about, back to our primary visual cortex, where the brain begins to sort out the visual information, and then it goes to other areas of the occipital lobe for more processing. Now you're probably saying, Dr. Tiff, yesterday or in the last video you said that our brain is organized in a way that makes it really efficient. So the parts that need to talk to one another are usually right next to one another. And you're saying if the eyes are in the very front, kind of underneath our frontal lobe, why is the occipital lobe all the way in the back of our head? There's a couple of reasons. First of all, like I mentioned, the occipital lobe is one of the earliest parts of our brain. So think like evolutionarily, a lot of animals have eyes, but not a whole lot of animals have these higher functions as far as like the thought and personality and planning and foresight that we have, which comes from our frontal lobe, which we're going to talk about more. And so the occipital lobe is kind of old, so it kind of got pushed back. It's also really protected back there. The back of your skull is very thick, and so it protects it really nicely. But that's also why, like, if you hit the back of your head, sometimes you'll see stars, kind of like on cartoons. And that's because when you hit the back of your head, you may be kind of bumping the part of the brain up against your skull, which is a very bad thing to do. But it will set off some firing, and so you'll actually see a visual effect when that occurs. All right, so let's go forward. Let's talk about our temporal lobe. So the temporal lobe is right behind our ears, and the temporal lobe is the part that deals with sound and language and anything that's auditory in nature. And so right inside our ears, just kind of above them, is our primary auditory cortex, and that's where the information from our ears comes in and is first organized and sorted out. If it's language related, and you're listening to someone talk and you're trying to make sense of the language, it's going to the Wernicke's area. Again, that's pronounced Wernicke, not Wernicke, but it's Wernicke's area just behind our primary auditory cortex, just behind your ear. And that's where we process language that's incoming. If we go to the top of our head, we have our parietal lobe. The parietal lobe contains our primary somatosensory cortex. So again, we've already learned that soma means body. So the somatosensory is the sensations of the body. So that part picks up all the different sensory feelings that we get. So touch, temperature, pressure, where our body is in space, all those different things are all coming into that primary somatosensory cortex. And the parietal lobe itself handles a lot of multisensory functioning. So understanding deeper into visual processing, as well as like directionality of movement and stuff like that. And then if we talk about our frontal lobe, on the very top, it's like these like two headbands on top of our head. The one in the back is our primary somatosensory cortex that we just talked about. But the one in front of that is our primary motor cortex. The motor cortex is what moves the different parts of our body. So each section of that, from top to bottom, relates to a different part of our body. So your hands are controlled by one area, your face is controlled by another, and your legs and your feet are controlled by another section. We're going to talk about that in just a few minutes as well. Also, we have our frontal lobe, and like I briefly mentioned, that has to do with our personality, our ability to plan, our ability to inhibit our actions, to stop and slow down and wait and think something through. All of that's part of our frontal lobe, and especially the prefrontal cortex. That's like our most advanced section in the front of our head, and that does the most high cognitive functions that really makes us humans different from other animals, and that's that prefrontal cortex. The prefrontal cortex and the frontal lobe in general is the last part of the brain to receive full myelination. So think about, we talked about how myelination speeds up the different processing of the brain, and it makes it faster, it makes it more smooth, and it just streamlines this whole process. And I mentioned before that myelination is not done until about 25 to 30 years of age. So, and the prefrontal cortex is that last part to be myelinated. So think about yourselves as adolescents, as teenagers. What are the things that you guys get accused of lacking the most? Typically it's planning, time management, foresight, inhibition, risk aversion, all those different things that you guys get a bad rap for. A lot of that's because your prefrontal cortex, which controls all those things, isn't done baking yet. Essentially, like it's baked for, 15 years, but it still needs another 10 to 15 more years to be done. So this prefrontal cortex isn't done by the time you're a young adult. It's not done until you're almost 30 years of age. And so those planning sections, that inhibition, that foresight, that adult-like processing doesn't happen until deep into adulthood. It's not by age 18. It takes much longer than that. All right. So I hope I made my point clear. It's not all your fault if you lack inhibition. A lot of that is actually your brain's development. And it's just not done yet. Also in our prefrontal or in our frontal lobe, we have Broca's area. Now, Broca's area is a really special area of the brain that also has to do with language. So we talked about Wernicke's area. Wernicke's area is what understands speech as it comes into our brain. So if you're listening to someone talking and you're making sense of what they're saying, you're using Wernicke's area. But Broca's area is a little bit different. So the story about how Broca's area was named was there was a doctor named Paul Broca. Back in the day, if you discovered a part of the brain, you could just name it after yourself, and that's what he did. And he worked at a hospital, and he had a patient who could only say the word tan. So he could understand what you asked him to do. So if you asked him, like, please take a seat, or please eat your dinner, or, tie your shoes, he could follow those instructions. But anytime he tried to speak himself, the only word that would come out of his mouth was tan. Tan, 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 tan. So they actually nicknamed this gentleman Tan. Now, when Tan eventually died, Broca did an autopsy and looked at his brain. And in the part of the brain where we now call Broca's area, there was a lesion, essentially damage to that part of the brain, most likely due to a stroke. And so essentially it was a dead hole in the brain. And so he realized that that's the part of the brain that is responsible for speech production. We knew he could understand, he could understand receptive speech because he still had Wernicke's area in place, but he couldn't produce language. He didn't have the necessary area of the brain to produce speech anymore. There had been damage there, so that's why he can only say the word tan. Now, if you're trying to keep Broca's area and Wernicke's area straight, the trick I like to teach students is that Broca sounds like the word boca in Spanish. What does boca mean? That means mouth. So you have to use your mouth to produce speech. So Broca's area is for speech production. Broca sounds like boca, mouth, and Wernicke's area is receptive speech. So hopefully if you remember Broca's area, you'll be able to remember Wernicke's area as well. In the very bottom of your brain, we have our orbital frontal cortex. That's where a lot of incoming processing is occurring, coming from your eyes. Also, we have our olfactory bulb that takes in some smell. But all gets relayed through the thalamus in the center of the brain as it begins to be processed. So there's our major components. I'm going to kind of reiterate that in the next few slides. So the occipital lobe is located in the back of the brain. It's home to our primary visual cortex. And we see two important pathways that link our occipital lobe with the rest of the brain. We have one pathway that connects the occipital lobe to the temporal lobe, so the part that is behind our ears, that allows us to recognize the objects that we see. So if I put a candle in front of you, the fact that you can recognize that that's a candle is that pathway between your occipital lobe and your temporal lobe. So it's kind of happening right in that space in between those areas. In our actual brain, there's no like demarcation or color change between those sections. It's like a gradient between those two regions. The second pathway connects the occipital lobe to the parietal lobe and allows us to process the movement of objects. So if you see a bird moving across the sky, you can track that bird and predict its movements because of the pathway between your parietal lobe and the top back of your brain and the occipital lobe in the very back of your brain. So if you recognize it's a bird, that's the first pathway, but the movement of the bird is the second pathway. And so there's some really interesting things that can occur with our occipital lobe. So some people have what's called visual agnosia. So agnosia is any inability to use your visual processing system. So visual agnosia is the inability to identify objects that are seen in their environment. So they could see a candle in front of them, they could describe the shape, they could describe the color, they could describe the flame, the wick, even the material that it's made out of. They could draw it by hand, but they can't name it. If you close their eyes and you put the candle in their hand, they could tell you this is a candle. But visually looking at it, they can't identify it. Like that pathway gets broken between that occipital lobe and the temporal lobe. So that's a really interesting phenomenon. Similar to that is facial agnosia, also known as prosopagnosia. It's a fun word, prosopagnosia. This is the inability to perceive familiar faces. So there's a part of the brain that's called the fusiform gyrus. It used to be called the fusiform face gyrus because they thought it only processed face information. But we now know it has to do with highly patterned information. But this part, if you have damage to this area or you're born with damage to this area, that's called congenital prosopagnosia, or there's acquired prosopagnosia. Acquired means it occurred from a damage like an accident or a stroke. But if you're born with it, it's congenital prosopagnosia. These people can't identify the faces that they see every day. They can't identify their friends' faces, their coworkers' faces, even that of their parents, or even themselves looking in the mirror. They don't recognize their own face. Now, if you ask them, they can see, there's nothing wrong with their eyes, but they can see their eyes, they can describe them. They can see the nose and describe it, the mouth, the lips, the shape of the face, the color, freckles, moles, hairs, all that stuff. They can recognize that, but they can't put it together to actually identify an individual with that. And that's what makes this condition so interesting. Some people have a really difficult time just recognizing faces in general. But when we see the damage to this area, that fusiform gyrus, which sits right between the temporal and the occipital lobe, that's what we call prosopagnosia. There's going to be a video in the channel below that you should check out where it's a woman who has acquired prosopagnosia. She had a stroke or an accident, and it caused her to have prosopagnosia. And so she can't recognize a photograph of her mother that she just took because she can't recognize her face. She has to recognize her mom by what clothing she was wearing. And they also show in the video that she can't recognize famous people's faces or even that of her own face. It's really, really fascinating and a little sad. People with prosopagnosia typically rely on a variety of other techniques to identify people. So in their family, they might ask everyone to wear a different color. So like their son will always wear blue, their daughter will always wear pink, and the person's wife will always wear purple. Or they will use clues as like their walking gait, so like the way that they walk around the house, or their voice. But it can be really difficult if they're in a store and they're not expecting to see like walk up to their spouse or a coworker, and they don't have like that time and place kind of ability, and they'll walk up to people and just completely not recognize their best friend of 30 years. So obviously that can be really debilitating and makes it really difficult for them to have a social life that's kind of what we consider to be normal. But with a variety of techniques and then understanding, they typically will be relatively successful throughout life. It's just something that has to be explained to new people. So please check out that video. It's really interesting. Our temporal lobe, this has a number of areas that are specialized for particular functions. Like I mentioned, it's home to our primary auditory cortex, which helps us process incoming sounds that come in from our ears. It also processes some of that higher visual system tasks, including the recognition of objects and face of familiar people. That's what we just talked about. And then it contains Wernicke's area. That's the area of the brain responsible for receptive language. So if a person has damage to that, so if they have Wernicke's aphasia, they won't be able to understand speech, especially the meaning of words, but they can still speak themselves. So they can talk, but they can't understand speech that's being said to them. Like they can't listen to the radio and understand what's going on. They can speak, but they can't actually understand it, which is really, really interesting. The parietal lobe, again, is in the back of our head, kind of towards the top. That's home to our primary somatosensory cortex, which helps us localize touch, pain, skin temperature, and body position. It also helps us process input from about taste. Also from the temporal lobe, it engages some complex processes of vision. So it's a really important lobe of the brain, but I think it's under-recognized, and this is the one that students forget the most often, so it's a cue for your studying. Make sure you focus on the parietal lobe because that's the one that gets forgotten most often. All right, then we have our frontal lobe. This is home to our primary motor cortex. This has a number of important sophisticated cognitive functions. The most forward part of each frontal lobe is our prefrontal cortex that's involved with planning of behavior, attention, and judgment. Again, these are the parts of the brain that take the longest to develop. I want you guys also make sure that you do the assignment about Phineas Gage because this is the part of the brain that he had damage when the rod went through his head during his accident. So this is the part that he had damage, so we see the changes of his behavior and his judgment abilities, which really affected his ability to complete his jobs appropriately. Also in our frontal lobe, we have our orbital frontal cortex that is located just behind our eyes, and it plays an important role in our emotional lives. Again, that's very closely related to our amygdala and the rest of that limbic system. Again, that area is just behind that orbital frontal cortex. Frontal lobe and language. So in aphasia, just like an agnosia has to do with visual systems, aphasias have to do from brain damage relating to speech disorders. So again, we talked about the individual named Tan. And so the frontal lobe contains Broca's area. That's the speech center that's part of the left frontal association area. So it's on the left side of the brain. We talked about that, how the left side, left hemisphere is responsible for speech and language. So that's on the left side. And it's responsible for speech production, writing, or speaking. It can be both of them. And if the person has damage to that area, they have what's called motor or expressive aphasia. They can't speak. Just like that guy Tan couldn't speak. He can only say the one word. Sometimes it's interesting. Depending on the extent of the damage, they can't talk like normally, but they can sing what they want to say. So depending on the severity of the damage, if it's really small or if it's more broad, you see damage there. This is actually a really common area where older individuals have strokes. So if you have like an older relative who's had a stroke and they lost their ability to speak, that's typically because they had a stroke on the left hemisphere, and typically between that frontal lobe and that temporal lobe where Broca's area is located. And that's where we see a lot of damage very frequently. So that can be really, really difficult for people to overcome, especially in older adults because they're not as plastic. So again, this is a really weird image. Do not freak out. This relates to our sensory and motor functions and our cerebral cortex. So I'm going to bounce back. If we look back at this image here, we have the headbands, I call them, on the top of our brain, which we have our primary motor cortex, and just behind that, our primary somatosensory cortex. So that's what these images that are kind of strange kind of represent. Is if you took a cross-section of the brain in that section, you would see essentially it wrapping around our head. You can see the little diagram at the very bottom, and they've laid out the parts of the body that correspond with the location on that cortex. So on the left-hand side, we have our primary motor cortex, and you can see, this is a really weird image, but like the brown, almost phallic-looking thing on the bottom is our larynx, and then above that is our tongue that blue to pink thing, and that has to do with our ability to vocalize. Also relates to swallowing and mastication, which means chewing. That sounds kind of dirty, but mastication means chewing. Above that, we have our face and our lips. And that is given a whole lot of space in our body because there's a lot of necessary touch and sensory ability that needs to happen there in order for us to have the fine motor movements that we use for speaking and eating and swallowing. Above that, we have like the top of our head, and then we go to our hand. There's a lot of fine motor movements that our hands can do that the rest of our bodies can't. There's a lot of space devoted to our hands, and then pretty much from our elbows to our toes, there's not a whole lot of space. So the majority of our body gets only a small sliver of that motor cortex. Our face, our hands, and our throats get a ton of that space because that's where we need that fine motor movement in order to speak, in order to eat, and in order to touch things with our hands and write and sew and play video games and text on our phones, all that good hand movement stuff. And again, we have something similar with our primary somatosensory cortex. This is the part of the brain, again, that takes in sensory information from the environment through these different parts of our body. So again, we have some intra-abdominal organs, and then we go to our pharynx, tongue, teeth, gums, jaw. So you have a lot of sensation in your mouth. That's why if you like bite your tongue or your inside of your cheeks, it hurts so bad, even though it's a small area. It's given a lot of space in our somatosensory cortex. Again, our lips have a ton of sensation. Even our entire face pretty much has a lot of sensation. And then we go to our hands, which has a lot of sensation. That's how we can feel a lot of really fine sensation on our hands. But then the rest of our body, our arms, our neck, chest, trunk, hips, feet, toes, don't get a whole lot of space. Our genitalia gets quite a bit of space, but as you can imagine, genitalia have a lot of sensory endings to it. So these are our primary motor and primary somatosensory cortex. And I hope you kind of understand like the amount of space has to do with the amount of sensation and motor control that is given to these areas. All right, so I'm going to stop this section. And next we're going to be talking about our endocrine system.